95.1 KVCM Monarch Radio, streaming 24/7 at kvcm.live and on Twitch at KVCM Monarch Radio. You're listening to DJ Starlight, and this is The Blender, where we mix it up around here. And today's topic is an interesting one. It's general health awareness, hit or myth. And today I have two good guests that are going to be informing us on some myths and some truths and some all that good stuff about health. And our first guest is Philip Suba.
Good morning. Thank you
for having me. Who has joined us last week, and he's here back again joining us. And our next guest is Kaye Remo. Thank you for joining me, Kaye. Are you there? Because Kaye is a clinical nurse who's going to be giving us some professional, suggestions, information, and all that. How you doing, Kaye?
I'm good. Thank you for having me today.
Thank you for being on. It's always a pleasure having someone that can inform our audience of new things, regardless of what it is. And today you're going to be informing us on some things in the healthcare field.
Wonderful.
Yes, and one of the things I was going to say is, the last few years have been really rough. They've been rough for everybody. And from your perspective, how has overall health in general changed?
Yes, thank you for that question. I think we, by now, all are aware that the pandemic has shaped more than over a year and a half or 2 years now of our lives, canceling plans, upending livelihoods, and causing feelings of grief, stress, anxiety.
Yes.
A lot of health experts say that pandemic may be shaping our mental health and wellness into the future.
Oh, yeah, for sure.
I think generally in the last 2 years, I've been a nurse for over 18 years now, both for pediatric and adult critical care environment. And even within the hospital setting alone, one of the biggest challenges we always have is preventing infection for patients coming into the hospital.
Oh, wow.
And we drive a lot of initiatives to ensure that us as healthcare workers and everybody coming into the hospital to really encourage hand washing. It's a very basic thing to prevent infection and prevent ourselves from getting sick. Good hand hygiene is very important. And believe it or not, 18 years later, we still talk about it in hospitals, still having a lot of initiatives. Not everybody's good at hand washing, even us healthcare workers.
Oh, really?
There's always a lot of movement on that. So I think that's one thing that changed in the last 2 years in terms of health hygiene in the public. Of course, now everybody has a little Purell bottle in their bag.
Now that we can find it, right?
Yeah, right. Like Clorox came up now with handheld everything, like handy dandy wipes that would clean the environment. We don't just sit down now in restaurants or wherever we go in public. We kind of are a little on the, I would say, cautious side, understanding now the impact of not having a clean environment and where viruses and bacteria really lie. So I think that's one big thing I could drive.
I like it. Now, is there a method to the hand washing? Because you said everyone doesn't do it exactly, fully. Is there like a method to it too?
There's a method, yeah. So there's a variety of method. World Health Organization is one of my favorite methods. We call it the WHO methodology, stands for World Health Org. And actually, if for those who travel a lot, especially in third world countries, rural areas, it's actually pretty amazing. I went home to the Philippines 2 years ago, and I learned the WHO methodology when I was managing pediatric ICU at Kaiser Permanente in California. And when I went home to the Philippines that sort of same year as we were doing that initiative, I looked up in one of the rural areas I was with that I literally was washing my hands with a bucket of water kind of system.
Okay.
And they have the little guide up there on the wall as to how to properly wash. And it's where we used to be taught, counting, singing your ABCs,
yes.
hand washing, but it really goes beyond that. There is an actual methodology that the World Health Organization has recommended. It is a couple of steps. It's kind of hard to demonstrate. But anybody could Google it. It's, again, World Health Organization hand washing technique. that's with soap and water, or if you have a Purell, it's all about the technique and not really the length of doing it. And it's
Yes.
also a lot of drying time.
Yes.
Okay.
Yes. I heard that too in the very beginning of the pandemic. Of course, we had to be able to do that in our facility too because we didn't want to close down for any kind of outbreaks or anything. But basically, our clinical director said it should be at least 20 seconds
heard
and
that
sing
too.
a song.
Yes,
And
yeah.
it's not just superficially washing the palms of your hands because it could go all over your hands. And you really have to get soap. And she really wasn't particular about what kind of soap as long as it was soap.
Right.
People seem to be very hooked on antibacterial
So, yeah.
soap. Right?
Yeah, that's definitely very convenient, but definitely there's nothing better than just good old soap.
Soap
and
water.
You have access to it, but of course, given our environment, we're on the go. There is a lot of appreciation for companies who did come up with our hand gels and
Yes.
hand rubs and scrubs right now.
Yeah, right. Because like some people, like you said, are really specific. Like they think that you have to have antibacterial soap
Yes.
in order for it to be effective. When
Yes.
you're saying that that's not the case.
Not really,
No,
right?
not really.
Well, that's
no.
good to know. That is good to know. And then with all this, that we've all been dealing with, also is I've noticed that a lot of people are have had some like social anxieties and stuff behind this. Like, so can you give us some some examples of how what people could look for as far as if they were going through that?
Yeah, so I'll just kind of tie that into the fact that, historically we know that pandemics and other public health crises, much like natural disasters, for example, have a lasting impact on everyone. We have post-traumatic experiences, again, such as natural disasters and other public health crises that might have been associated with the increased rates of substance abuse, post-traumatic stress disorder, and depression. And those same issues are rising right now. And there's a lot of studies going out there right now, and kind of understanding what healthcare providers can do about it and what we as a community can do about it as well. I think the surveys right now are showing what we expect, that there's an increased prevalence rates of stress and depression and anxiety. You're also seeing reduced initiation of treatments for patients with substance use disorders and a reversal of last year's reduction in overdose deaths. There is a lot of psychological trauma in the last 2 years, as you had mentioned. People are kind of unsure whether they should, is it safe to go back out to the groceries?
Right.
And
Yeah.
doing your daily routine, especially for, I do want to call out and recognize, being a parent myself, families with school-aged children are bearing the additional burden, because not only are they, us as adults, we have to take care of ourselves, but knowing that you have little ones who are also a very high-risk population, for getting sick, it's an additional burden, not only just by looking out for their health, but also adapting to the online hybrid learning, having the kids every day, 24/7, and no break from that. Everybody's struggling right now. There's lost structure, routine. People are working from home, but then they're in their pajamas. They're really not even getting up out of bed.
Right.
Which is, while it's nice, there are some impact on that on our health and wellness overall. There had been suggestions during the pandemic that even if you are working from home, you should do your routine, workout, shower, breakfast, coffee, whatever you would have done if you were going in the office, except that, actually change into your office clothes would make you feel
I like that.
better.
To have a semblance of a routine.
Yeah.
You actually bring up something very interesting, Kay. I have heard also that this has been impacting a lot of students that are maybe just starting college or university because they don't get that experience of actually being able to be brought to the dorm, live in the dorm and do all these things. I imagine, I've heard that there's probably a lot of anxiety and probably a depression around that too, because they can't
and they're
do
at
things.
a certain age, so you would
you
want to experience that
all
stuff.
of that, right? So I just with the graduations and going, I'm sure you've probably seen a lot of that too. How in what you've seen in medical settings.
Oh, yeah, absolutely. We have what we call the COVID babies, who are probably now right around age 2.
Right.
Wow.
And it has been very interesting that because of COVID, of course, the daycare centers were shut down, and so they really had very little socialization. So you can tell the difference with the older siblings coming into the clinics, coming into the hospital, like the COVID babies, aka COVID babies.
Yeah.
Are little or toddlers now. Definitely very different sort of approach with stranger anxiety. Typically, that's pretty normal for any for up to a year or 18 months anyway, developmentally.
Yeah.
But it's just a little bit more obvious that they kind of cope and interact differently with public. Like I've seen kids like clinging on to their parents because they just like I've never seen other kids and other people in their lives, so that too in itself is interesting. And then you have the kids who were probably at age 3 or so when the pandemic started, and it was a lot easier getting them to actually comply immediately with the mask and hand hygiene. More so than older kids and adults, actually. It's kind of like it just became part of their normal kind of growing up.
That's
in the last
interesting.
2 years.
Oh my goodness.
Yeah, so those kids are actually more resilient and like just adapted to the masking. They didn't argue about it. They just knew like it was going to keep them safe, and that's all they needed to know, and they complied with it. Again, back to the hand hygiene. I now have a 5-year-old, and we started pandemic. He was right around 3, and I will say he was definitely much better than
the most.
Wow. That is interesting. I would have never guessed that they would have adapted so quickly, like, because most kids don't want stuff on their face, on their hands, or any of that stuff.
Let alone to wash their hands. So
right. That's the thing.
Yeah, they kind of were just more resilient to the change. Of course, that's why it was recommended. The masking had to be above 2 years old for, of course, safety reasons.
Interesting.
And breathing and all that for our kids who cannot, control those just yet. But 3 and above, for sure, it was. They were a lot easier to sort of explain to the simple why. Why do I have to mask?
Right.
There's a virus out there that could really make people sick, and just very simple conversation, and that's it. I find that during the pandemic, I know a lot of the adults have struggled with the masking policies and the recommendations from CDC. We're all trying to figure out together, but for the school age children, it was definitely a lot easier for them to comply. They don't know any better.
Right.
Sort of that. But it's interesting how kids are actually definitely far more resilient to many things.
That is so interesting. I guess, because you work in that field, you see that kind of the changes all the time. I would have never guessed that they would be more just susceptible to, falling in the rhythm of things more so. Because I'm just used to kids just doing whatever, you know what I mean? Like not really falling in the rhythm. But that is really an interesting fact. That really is. And then,
it's true.
Being as though they can't really interact with their friends and, like you said, go to like the daycare and socialize with the other little kids, it kind of probably puts them in a situation where they're a little awkward, like you said, grabbing onto their parents when they go out. Well, for adults, this has really impacted adults with being scared to go out also, because they've had to stay in now. Like they're more scared, they're more paranoid, they don't want to. What would you suggest to people that are like that, or what are some of the signs?
I would highly recommend that families implement, or anybody implement, a daily schedule, again, to stay on task. Find new ways to have fun together, at home. If you're not comfortable yet to go out in public. Just having a routine, make sure that you're exercising, getting good sleep, getting good nutrition. Make sure, I will say this a lot to my kids too, make sure you're not spending too much time on your screen. Getting overloaded with information that you can't do anything about.
Right.
Stressful reading and seeing all of these things, and again, they may not be accurate information. And making sure we get also information from reliable sources is very important. As a nurse, I've seen a lot of patients, parents, families, Dr. Google, we call it. Great information out there on the internet. You have to be very careful. Which source are you reading from? Where are you gathering this information?
I totally agree.
At the end of the day, that's why healthcare professionals are trained in a different aspect. Kind of picking up certain things. We do it day in and day out. So it's important to make sure that people should find ways to connect with loved ones, and importantly, find ways of being in service. Having a sense of purpose is enormous during these times. And of course, I will always suggest, if anxiety and depression, feeling down is persistent, ask for help and reach out to your providers and get some support. There's so many support available now, online, internet, all that. It's popping out. There is a space now created for that. And I think, personally, to me, the silver lining that I find, and I know a lot of experts may have said this too, that the pandemic has created space in many people's lives to slow down, to spend time with family, refocus on what's important, and connect with one another in new ways. Identifying that this is there's a lot of post-traumatic stress around, this situation. Not just the last 2 years. I think we want to recognize that these things have always been existent. I think it's just definitely, again, the pandemic has just exacerbated it. When you are talking to people, I know you would ask about how we can, kind of just pick up if someone is struggling.
Yes.
Kind of good to just ask people, plain and simple, how are you doing?
Yeah.
And if someone, you can, it depends on how close you are, maybe with a person, kind of picking up body language and cues, and like looking at their eyes, and just kind of really being authentic and sincere about that question. And just really following up with questions such as, can you explain? Can you share with me a little bit more about that? Those types of things would be very helpful for someone to be able to open up, and share exactly how they might be really feeling. And then again, I highly recommend for anyone to be picking up on this cues, that have you talked to your provider about it? Have you talked to someone, professional? Consult with someone, having a counselor. I always encouraging people to kind of proceed to get help and care if they need to. But those would be the signs. I think it's always good to start with a conversation. Even in the healthcare field, yes, I could probably walk in a room and kind of do an assessment on people in the restaurants and say, the person looked like this, and I think that person may have that.
Wow.
I walk in or I can I could tell whether a patient, could be this or someone might be that.
Wow.
But there's nothing more powerful than just really having that open dialogue and conversation with someone you might know who might be maybe struggling, or maybe you might not know. But it's always good to just ask anyway. How are you doing? How are you holding up? Things like that.
I agree with that.
Yeah, it'll bring up a lot. It will open a lot of can of worms.
Yes. And then, if they did open up to you, how would you help them? Would you just direct them to some of the resources you were saying, or would you be able to help them in general, some advice?
I always recommend to go straight to a professional support and resource that's out there. It takes a lot of course, training and just really experience, I would say it would be key to really be able to counsel someone. So there's a difference between us family members and friends just trying to tell our friends and family, don't do this and that. But if you don't really have, the right words and the right moments and kind of knowing those types of training, I think it would be best to send them to appropriate resources and just be there with them as part of their support group. But again, I know even me as a nurse, I still could inadvertently say the wrong things to my patients that I was just trying to
help them,
comfort, help through. But a lot of times, nowadays it's getting more complex. Your word choices. I just learned yesterday from my conference, even kind of addressing and just picking out if a patient would prefer, it's called preferred pronouns nowadays.
Yes.
And I learned yesterday that it's recommended not to actually say preferred, because it gives the sort of thought that it's preferred. It's not option. It could still be an option, so it should just be a straight ask of how would you like to be addressed?
Addressed.
Okay.
Oh, that direct. Oh, wow. I didn't realize.
Okay.
I would have gone with the preferred pronouns.
Right.
I didn't know.
Like kind of unlearning what
Wow.
we learned with many things. And I think, with the pandemic and all the social justice situations that are happening, I mean, there's been a lot of really aha moments.
I bet.
There's always a constant ask of like, we learned about preferred. Is it preferred language? Well, they didn't prefer that language.
Right.
Yeah,
right.
This is what they wanted all along.
Mindful.
Oh.
That is
we have to be very
interesting.
mindful
That
of
is
a lot of
interesting.
things nowadays. I feel like again, learning a lot of the things we've learned and learning new things together.
Yeah.
I think that's very interesting what
Yes.
you mentioned, Kay, about getting reliable sources for wherever you're going to get help.
Reliable sources is the main key because, like you said, you may be giving information that may not necessarily be useful.
And a lot of people are doing that. There's a lot of recommendations from the Center for Disease Control, also from the World Health Organization. But then as things get what I call the telephone game, goes from one person to another person, they forget that you really should go to a reliable source just for simple things like this. Not just about hand washing, but just about where you should go for professional help.
Yes.
And I will just comment on that too. Yeah, I'm glad that you mentioned too that as a nurse, sometimes it's difficult to give that advice, even if you have training. From an HR perspective too, I always tell people, if I'm recognizing that they're having some sort of issue, that I would direct them to a professional, because we don't want to say anything that would inadvertently lead them like, well,
to the wrong direction.
He said this, well, she said I could do that, and it's definitely don't want that on your liability.
Yeah, right.
Sure.
Absolutely. And I also want to just add on to that too about a little bit about trauma-informed care. Again, it's easy for us to kind of give advice and whatnot, but we don't really know the journey of anybody really.
Right.
And what would trigger that person. Again, some of our patients and most of us, one way or another, may have encountered traumatic experiences in life that would make us naturally we find some people just naturally anxious and kind of like guarded, and so saying the wrong things may be a trigger
yes
for those patients or family members and friends. So yes, it's always best to just go
tell
ahead
them to see a therapist. I agree with that.
Tell them to see a professional.
And listening is good. Listening and giving them the space to talk about it. Okay. I think it's natural for most of us to kind of find solutions or offer solutions right away. But sometimes people just need someone to listen, to vent to, or talk to,
and to be empathetic and genuine too, right? I think that also contributes to people feeling comfortable saying that they might need help when you're taking a genuine interest in how they really are.
Yeah, I agree with that. And also a good support system. You know what I mean? A support system is, behind your therapy, a good support system where people don't judge and they're like, you know what, I support you. Whatever journey this takes you, I'm behind you the whole way. That's a big deal.
Yeah.
When people feel like they're supported, they can do anything. It's, and so a good support system, if you know somebody or anybody that's going through that, at least show them even, that you care, that you're genuinely interested in the fact that they're going to get better. Because it could change everything for them.
Yeah.
And mental health conversations have come a long way. I think there's always been a stigma around it, and by definition, what is mental health illness and things like that? We go to the extreme.
I agree.
Really just talk about it. That it's just something that you might need some support with in the moment. But I think we're starting to normalize this discussion about mental health and showing persons, and how we can support each other and what type of support system and resources are out there. So it's good to kind of have sort of that understanding as well, that it's still uncomfortable for many to even remotely admit that they're feeling.
Oh, absolutely.
For some culture, it's a sign of weakness.
Exactly.
That's so true.
Exactly.
That's
exactly.
so true.
That is very true.
That is true. Like, you put a stigma on that mental health, and it's always been in a negative light. It's always been spent like it's not a good thing. Like, you should never even say it. So that is so true in certain,
Yeah, they
cultures.
automatically think the extreme, like
Yes,
okay, mental
yes,
health.
yeah.
Oh boy, that means I'm
Crazy,
exactly
or,
that. I need to be admitted. Well,
need
I mean,
medication. Like, it's
ugh.
always a lot of stuff that goes with that, just that name alone.
Yeah.
Yeah.
And like you said, in certain cultures, it's not looked.
It denotes weakness.
Yes, yep,
For sure.
yes,
Yeah,
yes.
and people are so used to trying to be strong.
Yeah.
And they want to show that they can do things, but they sometimes forget that they do need to ask for help.
Yeah, and I can only imagine how difficult that is to ask for help, because, I'm a prideful person, and I know there's other people that are like that, and you just don't want to do, you just don't want to ask for that help. You just don't. Because it's something that you're either raised with or you're just like that,
Yeah, Kay, I've also noticed that, the strain on the healthcare system lately has been, well, just in the last 2 years, it must be incredibly difficult for nurses as well. They're the frontliners that really, I've spoken to a lot, I've worked with a lot. You probably get the brunt of a lot of the initial trauma, initial psychological effects of long-term effects that turn into something worse. I mean, we really want to make sure that we acknowledge what a tremendous job all nurses do.
Absolutely. You guys carried the torch. You carried the torch the whole way through the pandemic. It was like you guys were front and center. How was that experience anyway, now that we're speaking of that? How was that?
Yeah, so I will say that, even prior to the pandemic, like, I think, most hospitals are always, have always been rather on the busy side. There's never a dull moment. It's always already full to begin with a variety of things, be it that it's elective or non-elective situation. I mean, definitely the last 2 years had changed sort of the way we even sort of really manage patients in the hospital. Like, we, starting with the very issue about not having families. You can't just be, like, limiting people to come into the hospital. That be one of the biggest challenges, even for both nurses frontline and for on an administrative side, especially, just with adults being alone, they're sick and dying, and, kind of really having some sort of challenges, whether or not is it time to sort of, can we have the family come in? In my time in children's hospitals, there's a lot of families that are, again, wanting to sort of be there for their loved one in the pediatric ICU, very, very sick kids. And it was hard to sort of be, as nurses, to kind of say no, right? Because it's, every story is heart wrenching, and pulls that string, and it's hard to sort of control that. And we had a lot of disgruntled and really devastated family members that could not be there with their loved ones to the end. So that in itself is a big strain for many nurses. And it has been. I took care of several patients, teenagers that did have COVID. And boy, kind of wearing all those gear. And being stuck in this patient's room for 12, 16 hours. It was definitely very challenging to really manage. Normally we would just be able to, if we had a code, if we needed to do CPR and resuscitate a patient, you're looking at roughly, immediately you'll get about at least 20 people. And so if we're in a room that's already tight quarters, closed off, and then we're there, it was hard to determine how to even properly do 6 feet distancing at that moment. If all we're focused on is, of course, saving the baby's life, and it's just very tight space there. It was, those are some of the logistical challenges of, like, wait, do we open the door? Do we keep the door closed? And then, and then passing around, even not having enough equipment to, protective equipment was also a challenge. But some people were just, forget about it, barging in.
Oh my goodness.
Or having to reuse masks or anything, reuse gear. I remember
and then
hearing
everybody
about
was
that.
Running short of that
Running
stuff.
short and ordering from wherever they could. And on top of all of that, having to be the support system on both sides for the patient and then for the family.
And for their own family, yes, yeah. And for yourself, I mean, you had to try to maintain some sanity in your own world.
Yeah, and there have been a lot of challenges too with nurses, from nurses concerned about their own safety as well.
That's what I was thinking,
there have been a lot of ethical dilemmas caring for patients who refuse to be vaccinated in the first place.
Oh, right.
And then are now ending up sick in the hospital, and it's like some nurses had struggled with that.
Yes.
It was definitely like moral distress.
Yeah, I understand.
Do they provide like therapy for you guys, or do you guys have to find those resources on your own?
Most large organizations do have a department that we can always go to. We do have available resources. Most hospitals are pretty good about ensuring that they have the support system.
Okay.
Yes.
So we do have every hospital has their own kind of like sort of pathway as to what that is. And we have always our employee assistance program, of course.
Of course.
Most hospitals have that. And, just like a staff experience group or department. As a leader, I have encouraged a lot of just kind of having a town
assistance
hall
program,
or forums, allowing people to be able to share and vent and just express what's not working well for them in the front line, and really trying to understand how, again, to balance that patient needs and our needs and the staff needs.
And that's a balancing
act. That is a balancing act if I ever heard it. My goodness, that's a lot of responsibility.
It is. It absolutely is. It absolutely
I needed my own therapy.
You're right.
I mean, I always say, a lot of times leaders are put in sort of making sure, we take care of our staff.
Yes.
Of course.
And I think there's also sort of, I guess, a lack of resources for leaders as well, making sure that leaders out there who are dealing with this day in, day out know and understand that we too need help.
That's right.
Yeah, that's true.
And it's you with 200 staff that you have to look out for and take care of. Is also just an additional
an additional layer of support.
That is something.
Right. So that role in itself, through the role that I've had as a nurse leader, had also been, I would say, had been eye-opening during this pandemic. It's, again, not only am I trying to manage household safety during this whole situation and supporting, just, again, family and your community, but then you go to work and it's kind of, there's no sort of break. It's just very linear, like from home to work, it's the same thing. And certainly even more so at work, because we are dealing with critically ill children and patients.
Wow.
That is, that's
you never think about all these things like as someone that just goes to
the doctor, or they have to go to the hospital.
Okay, well, they just do this, but we never think about the layers of leadership that are involved just as much in the hospital systems, and
the stress that you must have to deal with.
And it's easy to say, we're just going to direct people to professional help.
Yes,
but
right.
Those people that are offering professional help too also need
somebody. I was just about to say, they need somebody as well to talk to. So that is really something, how you have to, it's like I said, a balancing act, and that has got to be challenging.
I guess this is a lesson for everyone, that we just have to try to be in a little more supportive situation for everybody else, because we all need to really support each other, because somebody needs help that's going to need help from another person that will need help, and I'm sure you felt that too.
Yes, I mean, absolutely. I mean, like I said, the last couple of years, you don't really realize the impact until it's over. And you're like, oh my goodness, like, look at all the stuff I had to deal with, or still dealing with. It's just a little less.
It's just a little less.
You reflect on it, you're like, wow. And like your situation, luckily you're coming, out on the last part of this, but that's a lot that you had to deal with for those last 2 years. And nurses were right there in front and center, with all that. It's almost like doctors, they were there, but the nurses were the real ones with the torch there. Like, you have to be at the finish line,
Yeah, we always say in many of our forums and whatnot, recognizing and acknowledging also just really, again, back to the trauma, right? Like, there is trauma around it, and there is trauma at work as well. and kind of recognizing that yes, doctors are there as well. There's a lot of ancillary staff. You have social work, respiratory therapists, everyone else. Leaders come and go, but a nurse is there for 12 hours, and they don't have a choice. They don't get to leave.
Right. You're like obligated to that situation. Yeah. So
that's I think one of the biggest difference with all of the healthcare professionals caring for a child or any patient really in the inpatient setting is that there's a lot of emphasis on how this whole thing impacted the nurses. As you said, yeah, we carry the torch and all that. It's primarily because of just the nature of our profession. Again, we're not able to really walk away.
Right, that's right.
A doctor may spend like a couple of minutes here and there throughout the day checking in and that, but they get to move along to see other patients. Nurses.
I
understand. Well, imagine all of that already on top of the general health awareness that you have to do, right? I mean, the things that were already existing before this pandemic happened.
Yeah.
Right? I don't know about you, but I'm sure that there are people that have been more heightened with what's going on now.
Yeah.
Just about getting sick in general.
And that's the other thing, like having to take care of yourself is probably another thing so that you don't. And that's one of the questions that we had today. Why do we get sick? If stress can be part of why someone would get sick. So that would be one of the things that we have today as far as the topic. Why do we get sick? It's from environmental issues, food if you don't eat properly, and stress. All can weaken your immune system, which would make you sick. When you guys are out there, or people in general, how would they prevent from getting sick all the time without COVID? Just sick in general, like we have like just colds or things like that.
Sorry, I actually. Zoom dropped off and just reloaded.
Oh, that's okay. That's okay. It's
one of the general health awareness problems of Zoom. It's okay.
Oh. Yeah. But we were saying about.
Can you repeat that?
Oh yeah. Why do we get sick? So I know environmental issues cause people to get sick. Stress and eating habits. What are some of the things people can do? We looked up. I know all of those germs, all of that stuff plays a factor in getting sick. And what are some of the things people can do to prevent reducing their stress, eating differently, and all that? We all know that's a part of not getting sick, opposed from COVID, just getting sick
in general.
Yeah.
In general. Yeah, I think we just have to also really define what we're talking about when we're saying sick, because I think from what I'm getting from your context is just kind of having a cold or cold-like symptoms.
Right.
And things like that, because you could also say being sick is someone who may have cancer, which is a whole different story.
It's a whole nother story.
No, really, some of the things that we humans get sick of are something that are not something you can prevent. But what can you do to prevent, of course, being sick? We try to, as you had mentioned, good nutrition, good rest, and really a lot of good mental health state. As we discussed earlier, kind of how do you reduce sort of that stress? There's both, I would say, like a metabolic factor, stress and psychological stress. Metabolic stress is when your body obviously is going through some things like fighting off bacteria or viruses that may have entered our systems. And that's more of that, or if your body is, maybe changing due to some certain diet, so you're going through some metabolic stress and you feel sick. And then there's obviously the psychological, kind of stress as well that could play into some of that factors of getting sick. But I think, for the very basics, again, we've discussed earlier about good hand hygiene. I think now we've also learned that, the masks actually do help. Also reduce some of those opportunities for organisms to enter, our body. So in a way, there's nothing wrong with continuing that if that would make you feel like, this has worked for me. And just kind of being mindful as well. If you have the sniffles and things, to also maybe consider, I'm going to go, I'll be public, but maybe, just be more mindful of it, and I'll throw in a mask. Again, caring for for the community, caring for others as well. This isn't just about me, but this is about me preventing the spread.
Of course, yes. And that's a good point that you bring up about bacteria and viruses. I know that was a very big thing up until now. Like what we mentioned before about the hand washing and everything. People immediately flock to antibacterial soap or antibacterial hand sanitizer. From what I understand, and I'm sure you've heard this too, that doesn't necessarily kill a virus.
Right.
And there are some bacteria on your hands that's actually very good. So you're killing all the bacteria that's there,
good
right?
Bacteria and the bad.
Yeah. I think what some people don't understand, and maybe you can shed a little bit more light on this, is that, when the virus enters your body, it attaches itself to something healthy in your body, and that's how it is allowed to grow. Right, so I think that's a big thing. I mean, do you get that a lot in terms of antibacterial and then antiviral?
Yeah, so I think, we could certainly dive into sort of, as you had mentioned, many of us would think like bacterial infections are caused by bacteria and viral infections are caused by viruses, two different things. And it is true in terms of sort of this wiping, hand hygiene and things like that. There are bacteria that definitely lives in, like, for example, our sink scrubs, right? Like, or our dish.
Of course.
So those are the bacterial things. Viruses kind of more, as we learn now more, right? Like COVID and flu, like symptoms. The most important distinction between both bacteria and virus is that antibiotics drugs usually kill bacteria, but they aren't effective against viruses.
Wow, yes. That's a good
very
distinction
big one,
right there.
Yeah, and bacteria, if I'm going to go a little more scientific, they're kind of, they're single-celled microorganisms, and they thrive in different types of environments.
Like heat, perhaps, right?
Bacteria thrives in heat.
Heat usually, yes.
Yep, they can live in extremes of cold or heat. And they make our bodies their home, like you had mentioned, the good bacteria as well, and they help us digest our food, and that's where you have all of those lactobacillus and things like that.
The probiotics that help with that
Most of
stuff.
them don't cause harm to people. Some that might be common for us to hear are like strep throats, urinary tract infection, tuberculosis. Those are sort of the bacteria that would definitely end up to be harmful, where you might be needing antibiotics to sort of fight that.
Fight off that bacteria.
And for virus in particular, right, they are even smaller than the bacteria.
Yes.
And viruses
Smaller than
require
bacteria,
living hosts, right? Such as people, plants, or animals to multiply, right? So those are two kind of sort of differences between what a bacteria is and what a virus is.
Got it.
When virus enters your body, like viruses can't multiply if they don't have
a healthy cell,
right? Again, people, plants, or animals, they need that. Bacteria don't. Bacteria kind of we're just
anywhere.
Whatever.
That's interesting.
Good distinction. I didn't know that.
I didn't know that.
And viruses, they just kind of more kind of take advantage of like here comes we jump on Philip.
I know a lot of people like that too.
Cells, and they just take over our cells and redirecting to produce more virus. And one of the common ones that we are, is more, we have more knowledge on by now are, of course, chickenpox is a virus.
AIDS,
of course.
Just the common colds, and now, of course, we have COVID and all those flu-like symptoms. So it is difficult to determine because the symptoms are all one and the same.
They are.
Everybody who's coughing and sneezing and febrile, everybody freaks out now. So it's kind of hard to determine pneumonia, and I think that's
COVID,
that I've always been concerned during this pandemic too. Is like every time patients come forward with symptoms, right? People come to clinics and I have the symptom. One of my concerns is the sort of delay in actual diagnosing the patient the right thing. Because then you have to go get swabbed first. Then you have to, there's like so much, a little bit more layer now. And we all point to like, do you have COVID? Like first rule that out. And sort of then rule out other things in the lab.
Which is where people are getting the mistake. They don't know if they have allergies or if they have a cold or if they have COVID. So
and people don't want to go seek for healthcare when they have the symptoms nowadays. That's another thing that's
They're scared
concerning.
to find
yeah.
out what it is.
They're also like, well, I don't want to go there and whatnot,
Yeah.
or I want to get treated. Or I'm fine, kind of thing.
And the similarities are just so close. That's the
It's
thing.
very-
That's why they just shuck it off. If it's like a sniffles like you would typically get, sneezing or whatever, you think, okay, that's allergies. So what do I need to go get a COVID test, or why would I even need to go get checked out? So you just kind of just push it under the rug, or you think that you have a summer cold if you feel a little bad. So I can see why people wouldn't be so quick to jump to go get tested, because it's so similar in those symptoms that you just you would just say, okay, well, let me just take some NyQuil or something and it'll probably go away.
Yeah. I mean, can you?
Some ailments do have and can be caused by both bacteria and viruses, like pneumonia, meningitis, or if you have diarrhea, it could be one or the other.
Yeah.
Yeah, see?
I don't know.
And
I
again,
have.
the symptoms are so similar.
Yeah.
Between bacterial or virus infection, you will present pretty much the same sort of symptoms, and so that's always like a challenge to these last 2 years. Is like, okay, is this COVID or is this something else?
Yes, right.
I mean, your allergies are bad too, aren't they?
They are. So sometimes it's like colds and allergies. Can you tell the difference? And from some of the research that we did, there actually is a difference between the way that your body is reacting, because seasonal allergies occurs when the immune system overreacts to allergens. And then colds are some of obviously the same symptoms of runny nose, sneezing, congestion, but you have the body aches with that. So those are the two ways you can kind of tell if it's allergies or if it's a cold. Would you agree with that? Because this is some of the research that we...
Yeah, absolutely. Again, it's, healthcare professionals are trained to look at more of the global picture of patients who come in, but general public want obviously kind of have that extra training and experience to kind of determine what those are. But yes, I think it's good to sort of pay attention to what exactly your symptoms are. Are you having fever with it? Are you having, and that's why you always repetitively ask these things from the time you walk into a hospital or emergency room, urgent care. It's the same repetitive questions, because that paints the picture of that will help point to sort of what diagnostic tests need to go next to diagnose the patient. But yeah, it's kind of hard to just say, if one would come to me and be like, oh, I started sneezing and having a cough.
Right.
Okay. Most likely I will follow up with other questions, as I mentioned, like, are you feeling this? Are you feeling that? Because, some of the more common sort of diagnosis do have like a certain pathway, as you will. Okay, if you have a combination of this, we could most likely lead you to sort of this type of diagnosis.
I gotcha.
So a little more complex process, but in general, I think that's where it's always hard with a public to really understand, like, is this COVID or not COVID, or is this something else, and do I really need to get help now?
Yeah.
Or can be?
That kind of narrows it down when you ask those questions. And then another thing too that we found that, a cold usually only lasts between 7 to 10 days, but allergies are a little bit more persistent. So that's another distinction right there too.
Yeah, absolutely. I think just really knowing your body and kind of paying attention to what those symptoms are important, because that will also help your healthcare provider determine whether or not you may need additional testing, or they need you to come into the clinic and actually do further workup, or that they could listen to your lungs if needed, if it was something respiratory type stuff.
Yeah.
So yeah, just a lot to take into consideration before we could actually say, oh, okay. This is viral or bacterial infection, and do we treat it or not treat it?
Gotcha. Oh, that's good to know, because like a lot of myths are out there that how you get colds and how you get these. So like one of the myths.
Oh,
tell
yes.
us one of the myths
I was
that we
just
found.
talking about this
Or
the
myths
other
or
day
truths.
with
We
you.
don't know whether
We don't know if
we're
it's
just
true or
we're
not,
going to
but
come up with it.
I remember talking with you about this the other day, because some people prefer to wash their hair in the evening and take a shower, and I remember I used to do that, but I actually stopped because I remembered, somebody once told me, if your hair is wet and you go to sleep, you're more susceptible to getting a cold. And I said, I don't think so. But I could see though that probably isn't the best choice to do, but
But that has been a long-standing thing. Like, do not go to sleep with wet hair.
Or just cold weather in general would give you a cold.
Or
right?
if you're walking in the rain and you get soaking wet, and
yes,
then, you know what I mean.
You're like, you're going to catch a cold. You're going to do that, and I mean I think that happens mostly because your immune system goes down,
yes,
right?
Yeah.
I don't think it's necessarily because you're out in the cold.
What would you say to that? Would you say that it's because your immune system is weakened, or that's a legitimate thing? Like, if you
like getting it from a cold or from the cold weather, I mean.
Well, I think we could safely associate that when it's winter time, the viruses are out, right?
Yes.
We have flu. And that's kind of how we thought in the beginning, like, maybe in the summer, COVID was going to go away, right? Because we're so used to the concept of having flu. So it's not, it wouldn't be unusual to kind of then sort of tie the cold weather with obviously, you getting sick. Because most likely the virus had been out there, you went out, you rubbed your nose, you rubbed your eyes, and unfortunately, those things that we all have learned to avoid doing without hand washing again. We may be out there, it might have been a Christmas party. And we're out there mingling, and the viruses love their hosts. So if there was one carrier, it's easy for them to then hop around. And so by the time you got home, people kind of tend to then associate, like, oh, it's because it was raining or snowing, or like it's cold.
Okay.
But really, you could have picked it up in many places along the way, and no, it's not necessarily because you walked around with wet hair during the winter and things like that.
So that's a myth then. That's good that you cleared that up, because a lot of people really go by that, So that's good that we cleared that up.
Yeah, I grew up with a lot of those, beliefs in the Philippines. And I remember growing up learning that, to treat fever, we put a bunch of blankets and to sweat it out.
Yeah.
But when I became a nurse here in America and went to school, realized that you're supposed to be butt naked if you can be.
Really?
Wow.
Interesting.
That is
Sorry
interesting.
for my poor language.
No, that is.
No.
Anyone, but it's just that was the whole concept. So now it's interesting in the healthcare, in the inpatient. So I'm in the pediatric ICU, as I mentioned, and we would have a baby who might be febrile, and that family and patient might come from a cultural background such as mine, or a certain culture who still believe that. So it's kind of like this kind of parents are trying to put the blanket on and nurses are trying to strip it off.
Wow.
Like kind of communicate really well with the families to make them understand. Like, they're like, why are you putting ice cold, washcloth on my child's forehead? Shouldn't it be warm? Like kind of things like that. So just a lot of kind of re-education, and even for me again, relearning things.
That's very interesting. I never would have thought that. I thought you would that's what I thought too. You should sweat out a fever and bundle up, and so that it promotes your sweating. But I guess if you're already hot,
especially for kids, you don't want them overheated
and get dehydrated. Maybe,
Yes.
But when you overheat, when a child gets overheated, they run into a lot more issues and problems. The heart rate goes too high, and might lead to febrile seizures.
Yes.
So there's just a lot.
That's interesting.
More, so it's good to always control.
Stay hydrated.
The fever ASAP, because kids just have littler but body surface and different, reserve.
Wow.
So,
and that's another. It takes us to another thing is for whether this is true or not. When people say, "Does the flu shot give you the flu?" A lot of people think that once they get that, they'll get it. According to research, that's not the case. Is that true? Do you get the flu once you take the flu shot?
You will. Well, let's see. Let me. I'm trying to kind of rephrase this to make sure that it is clear. So, it's possible to get sick with flu if you have been vaccinated with flu. Like, kind of kind of getting it. It's just like, with COVID, same thing. You are given
Yes.
the antibodies for it.
Okay.
Yes.
You maybe sort of could also be possible that you may have already, again, back to the exposure, right? You may have
Yes.
already been exposed
Okay.
before getting vaccinated.
Yes.
So there's really no telling whether
If you really got
it's the
it
flu
from the
shot
flu
that
shot.
gave you that.
Yes.
Right. Okay.
Because you might be sort of,
Compromised, maybe. because you've
already,
been
yeah.
exposed.
Yes. Right.
No, that makes sense.
Yeah, the
Okay.
vaccinations, obviously would still be the best way to protect yourselves and your loved ones against like flu and that potential serious complication.
Yes.
But that's essentially sort of what it is. It's like the vaccine is sort of the live antibodies that you kind of
Okay.
get. And that's why
Okay.
they're very similar.
Yes.
You could still really get it, as we learned now
I guess
too.
so.
Right?
Yeah, that does
Yeah.
make sense.
With COVID, like you may have been vaccinated, but you could still
You still get it.
And your
Yes.
body's
Yes.
just fighting off whatever's in there, right?
Yeah, there's so many
Yeah.
strains out there
Got
too
it.
that each vaccine is kind of created differently to
Right.
address
Got
and
it.
fight off all this.
Yeah.
Well, there are so many myths and
It is.
conceptions
Yes,
out there,
it
but
is.
trying to drift away from colds and flus and viruses and everything, this is something that I've always wanted to know, and I did my research on it. Cracking your knuckles,
Oh,
or
that's a
cracking
good
joints,
one.
because I always
That's a
crack
good
my
one.
neck,
Yes, yeah.
myself, and crack my knuckles, and people say, "Oh, that's not good," or "No, it's okay."
Right.
Yeah.
What are your
But I
thoughts
think
on that?
cracking your knuckles.
Yeah, and like
Yeah.
cracking your neck or releasing any of that air pressure.
Like, is that damaging to your joints, or is that something that's okay? Because it sounds painful. First of all, because I
Yeah.
don't crack mine, but it sounds.
I'll stop doing it if you
But
tell
is
me
it
to.
damaging to your joints?
No, I mean, I don't. I have not come across sort of a solid science that would say like, oh, don't do that.
Okay.
We have a lot of chiropractors and
Yeah, because that's a common
physical
Yeah, some
therapists
people really
who
think it.
actually you might need that sort of stretching and whatnot. And so yeah, I think that would be that's actually not like a bad thing to do if you're just stretching and kind of really relieving sort of the pressure on your joints kind of thing. But
Right.
I think I'm not sure if that would be like truly on like
Yeah, because actually, from what he
Yeah.
did research, it actually says that it does not cause that
Yeah.
bad much damage. So, but I wanted to know from a professional, like,
yeah,
people do it
no,
all the time. It's a regular thing.
It shouldn't be, and just like again, back to the flu vaccine, right? Like, no, it does not. It
Okay.
does not cause you the flu. You might have the flu-like symptoms.
Yes, right.
But other than that, no. I mean, the viruses have been killed in most of these vaccines,
Okay.
so they're not really infectious.
That's good to know. Well, at least
It
I don't
is.
need to stop cracking my
And there
knuckles
you
now.
go. There
Thank
you go.
you.
Well, Kay, it's been a pleasure having you on the show today.
Yeah, thank
We're
you so
winding down.
much.
You've been
Oh,
an
you're welcome.
awesome.
Thank you for having me.
Oh, you've been an awesome. Informed us on so many good things. We had a good show today, and we'll probably have you on again.
Yes,
possibly,
please.
if you're willing to come on again
Anytime.
and be with us.
Anytime.
So we're gonna have Christina up next, and everybody out there can join me next Sunday, same time, 11 a.m. Pacific Standard Time and 2 p.m. Eastern Standard Time. Every week we'll have something different. It's the Blender, so join us next Sunday, and Christina's gonna take it away. Stay positive and test negative, everybody. Thanks for listening.